have all the information that you need. And we want you to be able to rely on us and the welfare fund to direct you to the information that you need, and to also be apprised of what the union is going to do going forward. So thanks for the opportunity to be here today. And thank you to the retirees chapter leadership, Anne and Bonnie and Diane, for helping to facilitate. So let me turn it back over to you, Anne.
Okay,
And,
I think
so what's happening, Ann, is that as new folks come in, they're coming in unmuted. So I'm going to mute everybody again and then invite you to unmute yourself, Ann.
okay. Okay. Okay, so I feel like I'm a little bit on like one of these TV talk shows where, you know, after the event happens, you know, you've got the experts come and sit around a table to debrief. So we're going to have a short debrief from our policy experts. Debbie Bell and Barbara Caress are here to make some observations about what you heard and saw earlier. Donna Costa is here as well, and she may chime in if necessary. We will get to your questions as soon as possible, people. Please be patient. Thank you. Debbie, Donna, Barbara, I don't know who's starting.
I'm starting.
Okay.
You can hear me, yes?
Yes.
Hi, everyone. I just want to, Barbara Caress and I, along with the retiree chapter leadership, have been monitoring this process really for 2 years, and trying to both anticipate your questions and concerns and also listen carefully to how both the Aetna plan administrators and the city of New York are dealing with this transition. And part of the problem we face is not just that, as many of you have commented, this is not a change that any of us wants, but also the city of New York, which administers this plan, is very inexperienced at a variety of things having to do with large transitions. So what we have been doing is keeping track of questions, both those that have been raised at retiree chapter meetings. We will get a copy of today's, both what was asked in the meeting and also the chat. We will get a copy of this meeting's chat, and compile those as questions going forward, to which, when we are sure we have gotten an accurate answer, we will post on the retiree website. And that when is very important. There's some questions that have been raised that I'm just not convinced the city knows what they're doing. So their answers haven't been posted yet, but please, we'll get to this later about the value of the retiree website. In the meantime, my colleague Barbara Caress is going to review for you some of the key questions that came up today and her comments on them.
Thanks, Debbie, and good afternoon to everyone. I have more questions than answers, and I'm going to review my questions because Debbie and I will be hounding Aetna and OLR for answers. So if this is your question, don't ask it again. We don't know the answer. But let me begin with just a general statement about the issue of doctors who are not in network. Because it sounds each time Aetna or their predecessor talks about this plan, the PPO aspect of this plan, everybody's going to participate. Don't worry about it. And in point of fact, that's not true. And the question is, why is that not true? Since they get paid the same amount they would have gotten paid from Medicare. And the reason is that there are many doctors who are not, quote, willing, to use the language that the Aetna reps kept using, who are not willing to take the chance, if they're not already in network, to take the chance of submitting a claim and having it denied. as not medically necessary because they won't get paid and the member is on the hook. So that's the principal reason why some doctors, even though they have a PPO option, and even though they will pay the rate that Medicare would have paid, that doctor don't participate. So I just want to put that out there. Not everyone participates. Many people do. Aetna has a very large network. And if your doctor is in the network, or your doctors are in the network, you're in pretty good shape. If your doctors are not in the network, you need to have careful conversation with them in their offices. Having said that, I'm just going to go down the list of the questions that I still have that Debbie and I will continue to try and get answers for you. And we don't know yet what those answers are. And this is a random order of just notes that I took as we listened to the presentation. Aetna said that they will honor any emergency claim and pay it. And I don't know that that's actually the case. They still have the option of determining that the claim is not medically necessary. I don't know the extent to which they honor emergency claims, and we will ask that question. They implied that there are network doctors who have signed contracts with Aetna who are not listed on the website, and I'd like to know why. They went over a list of copays, the $15 copays for a variety of services, and the $300 per admission copay. And I'm wondering if that is not in violation of the court order. I don't know the answer. And then I have a bunch of questions about continuation of care, which they were not clear about. They called it continuation of care support. And does that mean support when to get somebody to transition from non-Aetna to Aetna network physicians? Or does it mean support for somebody who will be permitted to stay with their current provider, even if they're not currently Aetna network providers? That's one question. Second question is, when you submit an application for a continuation of support, how long will it take before they respond to them? How long does the process to approve or disapprove that authorization take? Another question is the 12-month trial period. The 12-month trial period in traditional Medicare is for people who enroll in Medicare Advantage for the first time when they're new Medicare recipients. And the question is the 12-month trial period for people not new to Medicare? I don't know the answer. Just a point, they kept saying if it's covered by Medicare today, then it's covered by Aetna. And my comment to that is, yes, that's true, but it doesn't mean that it's covered by this provider. Another comment is for people in hospice, Aetna is not responsible for the claims associated with the disease that caused somebody to be near death, but Aetna Medicare Advantage remains responsible for claims for things not associated with that. For example, a person has lung cancer and breaks their leg. Paying for the cost of the treatment for that broken leg remains with the Medicare Advantage plan. And then my last question, which I think is a little weird. So on the surviving spouse question, she responded by saying that you're entitled to buy COBRA for 36 months. And I'm wondering if it's COBRA at the $15, which is the premium that they're charging the city, or it's COBRA at the $1,000 a month, which is the amount that they're getting from CMS. I don't know the answer to that. So in any case, I hope this helps. I hope I've preempted some questions because we don't know that you can ask the question, but we don't know the answers. Thanks.
I'm going to pick up now and The other part that we feel very important to all of you is that there are very few answers that apply to everybody. It is critically important that you do your own research, talk to the doctors you have, look at the Aetna plan, the materials that have been sent. If you have not received them by sometime next week, do what they told you to do. Call the general number and ask them to mail it. They seem to be responsive to directly mailing the package. I will note, however, that most of the materials in that packet are all the materials that are already on the website for the New York City Office of Labor Relations Employee Benefits Program. Their homepage says new Medicare Advantage plan. For more info, click here, and there's a whole list of links, including, as somebody asked, where is the evidence of coverage? You can find it there. It is a lot of legal jargon. It's a pain to read through, but that's really where they've put in all their rules about how they operate. We are educated people who should be able to read and understand what's there. I've had to read several sections multiple times to be sure I understand it. I mean, I'll be honest. So it's complicated, but each of you has a different situation. You're different ages, you have different medical issues and different concerns. The other thing I want to stress is the term opt-out doesn't work the same way it did a year and a half ago when we were told we could opt out and pay for senior care. Senior care will be gone. If you call Aetna to opt out, they may assume you're opting in to HIP-VIP, because that is the only other plan the city will be offering as of now. If you decide, and I encourage you not to rush into this decision, if you decide between May 1st and June 30th to waive your New York City coverage, that is, you want neither Aetna MA nor HIP-VIP, you have to fill out a special form on the city, again on the city website, which has not yet been posted, to waive coverage. So the language really that we're working with is you can opt from Aetna Medicare Advantage to HIP-VIP. You can opt, which is a Medicare Advantage HMO plan with a more limited network of providers. You can opt from HIP-VIP into the Aetna MA plan, again, by going to the website and locating the special enrollment/waiver form. And in this case, what you're doing is you are enrolling in the Aetna MA plan. Again, it's not there yet. Well, they said it'll be up by May 1st. Or you waive coverage. Those really are the options. I'm gonna try to, it's complicated. Are you in Aetna Medicare Advantage forever? And the answer is no. Every year, the city offers an open enrollment period in November, the month of November. Medicare itself offers an open enrollment period between October 15th and December 7th. So it's a longer period, which the city will acknowledge. In other words, if you go on and say, I want to enroll in, do something different on October 31st, that's okay. But remember that if you're either going into Aetna MA from having waived coverage or going from Aetna MA to back to traditional Medicare and you want to waive coverage, you still have to use that form that's going to be on the website to tell the city what you're doing, because the city administers your coverage, even if you've waived it. But you will have the opportunity to move back and forth. In addition, there are other periods, as Barbara Caress alluded to, there are other periods when you can do some moving around. But for the moment, I'm not convinced that the city will do the right thing and make sure you move unless you're operating within the periods that they've identified. Therefore, in theory, you can drop out of a Medicare Advantage plan at any time during the year, almost. But you may end up being stuck with nothing. And that's why we're not putting up on the website, you can do it any time of the year. It is important to note that if you change during the open enrollment period, the effective date for the change will be the subsequent January. It won't be instant, it will be the subsequent January. The other important thing to note is that if you have never exercised your right as a city employee or retiree for a once in a lifetime plan change, that still exists for you. You could, May of this year, something happens, you're going to need many and complicated procedures that you're not convinced will be, well, May of next year, let's say, not the open enrollment period. Next year, when you're under Aetna Medicare Advantage, you require many and complicated medical procedures, and you want to go back to traditional Medicare, you can exercise your once in a lifetime right to change plans outside of the normal period. And what happens is that takes effect either the beginning of the next month or the following month. But if there are urgent situations, you can contact the welfare fund to help you navigate with the city employee benefits plan. These are the things that, as we are assured of how things will work, we will post on the retiree website. I just want to, Bill Friedheim was going to put up a link to the material we have on the website at the moment, and I was going to run through it pretty quickly. The other thing is that you should feel confident that we are keeping track of your questions. When we have answers, we will post them. In addition, following today's meeting and the confusion about the match between welfare fund benefits and what Aetna offers, I'm going to ask the welfare fund to post some FAQs about how those benefits will interact. Your primary prescription drug, hearing, vision, and dental benefits are from the welfare fund as retirees while you have city coverage. At this moment in time, retirees who waive city coverage will not be covered by welfare fund benefits, but the union is actively working with CUNY and the city of New York to ensure that those benefits will continue for you even if you waive city coverage. So, stay tuned. That's not a done deal yet. So where's Bill? He was going to post this stuff. Anyway, so that we're going to continue. So the thing I want to urge you to do is to review the retiree webpage frequently, because we're going to be updating it frequently. I'll give you for example that I learned yesterday. The city had been saying that for those retirees with dependents who are not Medicare eligible, they would all have to go into GHI come September 1st. That has now changed. Non-Medicare eligible dependents who are in the Empire EPO or the Aetna EPO can stay in those plans. The other plans, everyone else will go into GHI. So Bill is scrolling down the various elements that are on the webpage. We have a bit of a history of how we got into this. We have very important contact information. Let's pause on this page, Bill. The letter from New York City retirees, a letter to New York City retirees that was dated March 10th, that you should have received. If you didn't, it's here, you can print it out. Why is this letter important? This letter is important. Print it out, put it in your health insurance file, because this says senior care will no longer exist after September 1st. So if you should waive coverage and look for a private Medigap plan, you'll need this so you can say, I no longer have coverage. That's why I need a Medigap plan. In addition, we want to be sure, the Office of Labor Relations has your correct address. So there's a link where you can update your mailing address. Here is the link for the Aetna evidence of coverage plan. Again, it's very long and it's legalese, but it's, it's worth reading if you have questions and you're considering alternatives. In addition, they're linked to the Aetna's frequently asked questions, and the brochure for providers who have, if you have a provider that's not currently in the plan, so they can, why Aetna's arguments why they should join. There's the Aetna call member services phone number that they said dedicated to New York City employees, and the website. Then in terms of if you are considering what you want to do going forward, some very important information about Medigap plans. Just to go through this again, what does this mean? This means if you are considering waiving city coverage, so you do not have to go into the Aetna Medicare Advantage plan, you will maintain your right to traditional Medicare. You don't have to do anything. You will be in traditional Medicare. But without senior care, the 20% of the cost of your outpatient benefits and certain inpatient deductible costs won't be covered. We encourage you to get a Medigap plan that will cost you some money and requires some research. So there are two links. There's the first one is information about Medigap plans in New York State. Happily, for those of you who live in New York State has very good rules. There are no limits for pre-existing conditions, etc. In addition, the next link is from federal Medicare. It's a document to compare. What you'll find is that there are a variety of Medigap plans offered in each state. This is a general comparison. The link allows you to put in your sex and your zip code, so it can give you the state-specific information. And then the third bullet there is the Medicare Rights Center, which is a critically important resource for all of us. They are a nonprofit group that has been in the business of giving information about Medicare to callers for several decades. I've supported them for several decades. They are terrific. The people who answer the phone are very well informed, not just about New York, but about all the states around the country. So you should call them if you have specific questions. In addition, they talked a bit about the continuity of care. There's a link to the brochure and to the form. The reason, as Barbara Caress said, we have a bunch of questions about how responsive they're going to be, how quickly they're going to help you, when they'll make decisions, etc. On the other hand, if you are concerned because you have ongoing treatments or surgeries scheduled, we do think you should begin the process of exploring with Aetna what they're going to do for you and trying to figure out, particularly during this period of potential change in plans, whether they will continue to provide you the benefits you think you need on an ongoing basis. Okay. So, Bill, let's go to the what you need to know section.
Yeah, hold on.
Yeah. We're doing this, folks, because this is where we're going to keep putting information. Please tell your colleagues that it's here. I'm sure there are people in this meeting who are learning about this for this shift for the first time. A lot of the questions that come up in every meeting are the same questions. So what we have put up so far are the basic information that you need. Come September 1st, you will be automatically enrolled in the Aetna Medicare Advantage program unless you are already in HIP VIP, have opted out via Aetna to go into HIP VIP, or unless you have waived New York City coverage. Again, and the language here hasn't been updated yet because I just learned this yesterday. Non-Medicare eligible dependents who are Medicare eligible will also be treated the same way the retiree is treated. So they will be enrolled, if they're Medicare eligible, they will be enrolled automatically in the MA plan, Aetna MA plan as well. If you have non-Medicare eligible dependents, they will either stay in the Aetna EPO, the Empire EPO, or they will stay or be moved into GHI. Senior care will disappear. It will no longer exist. And at this time, New York City is not offering a different supplemental or Medigap plan. Again, the March 10th letter from the Office of Labor Relations, which is on their website, print it out, put it in your file so you have it. Aetna materials have been mailed. If you have not received them, call the Aetna phone number and ask them to send it again. Okay, going down the alternatives, we've sort of reviewed that, but that's there in writing for you to review as you need to. Okay, now how to think through your options. Again, you talk to your doctors, figure out if your doctors are in the Aetna plan. Barbara Perez suggested that there are a lot of doctors, particularly for those of us in New York City, who accept Medicare, but don't want to have anything to do with Aetna MA, don't even want to have to bill them. So we are going to try to figure out exactly what the sanest way to ensure that you get reimbursed for your care, because they should be charging you Medicare rates if they accept Medicare, and you should be reimbursed those Medicare rates if you pay them, or they can bill Aetna. But part of the way Aetna punishes providers for not being in their network is by making them undergo a lot of paperwork. Okay, let's keep moving because I want to leave time for questions. What else is up here? So what happens if you waive coverage? There is an article, and someone's going to put a link to it in the chat that's in the retiree newsletter that's being printed this weekend and mailed, about how to figure out what it's likely to cost you. You will not be reimbursed for Medicare Part B, which is for this year about $2,000, and $2,000 plus $2,000 for your spouse, if that applies. You will not be reimbursed for IRMA. This is a city position, which they've implemented for years. We'll see if it's challengeable. So that's money. If you waive city coverage, you will not be reimbursed for that. Again, here is the link to pricing Medigap, and if the welfare fund is unable to change its coverage language, a Part D plan for drugs, but we're optimistic that the parties will negotiate the ability for people who waive to retain those benefits. Critically important, your dependents, if you waive coverage, your dependents will lose coverage. If you have a spouse who is Medicare eligible, that spouse will continue to be Medicare eligible for traditional Medicare like you. However, if you have non-Medicare eligible dependents, a spouse, children, grandchildren who are on city health coverage, they will lose that completely. This is just a list of the welfare fund benefits. Anything else on here, Bill?
I
Are we
don't.
done? Oh, this is what we know so far about the right to change plans. So this is in writing on the retiree website. This is what we know will work. You know, you can, the main thing to keep in mind is every November, there is an open enrollment period, which change will take effect the following January. As we confirm that the city will handle things more flexibly, we will post that. Okay, I am being asked again, don't rush to waive city coverage May 1st. We are continuing to collect information. We are continuing to figure out what works and what doesn't work. We will post it on the website. We will continue to come to retiree meetings and answer your questions. There isn't a rush. You have until June 30th to make a final decision. Okay, I think I'm done.
Yeah,
Okay.
let me just note that I'm posting the links again to the sites that you just saw, and also to the article in the retiree newsletter that Debbie referred to. And yeah, I just posted it again in the chat.
Thank you, Bill.
Okay, thank you very much, Bill. Thank you, Debbie, and thank you, Barbara. Dean, is there anything that you urgently want to say before we go to the questions?
Yeah, just, Debbie mentioned some of this, but I just want to reiterate a couple things in terms of our political, you might call it our political resistance strategy. One, and the most urgent for us, is that we are working with CUNY to negotiate a change to the language in our collective bargaining agreement with CUNY that currently requires people to be enrolled in city-sponsored health insurance in order to be eligible for welfare fund benefits. So we have scheduled a meeting with CUNY for next week to try to conduct those negotiations. So folks should know that we are fighting to do that. We've also talking to the welfare fund about the language in their trust indenture that is very similar to that language that also needs to change. And we are working to do that. And until we're able to do that, we have to keep saying to folks that if you decide to waive city coverage to keep your traditional Medicare and pay for your own Medicare supplemental coverage or Medigap, then you will not be eligible for welfare fund benefits. But again, we are working to change that, and we're working urgently to change that. The second thing is that we have not given up the fight for the city to continue to treat traditional Medicare and Medigap as city health coverage. So we are looking at our options, trying to figure out what is the best way for us to do that. One possible option that we're looking at is once the council is able to focus on the issue, once they get the budget out of the way, potentially amending 12-126 to make it clear that people in traditional Medicare who also have Medigap are in city-sponsored coverage and therefore should continue to be eligible for Medicare Part B reimbursement and IRMA. Again, that's not currently the situation. That's something that we believe should exist. We are continuing to fight for it. But as of right now, again, if you're not in the city-sponsored coverage, that is, if Aetna's Medicare Advantage or HIP VIP, then you're not eligible for Medicare Part B reimbursement or IRMA. Finally, as folks are noting in the chat, the retirees have promised to sue regarding the situation. We've been in contact with the retirees' lawyers. We know they're planning something. We don't know exactly what it is yet, but that also is still on the table. So I wanted to make sure folks were aware of, the ongoing political fight that we are continuing as we try to get you the information that you need in order to make this decision that's being forced on us all. So
And
thanks.
I just want to add, Dean, and you'll, I think, agree with this because there are questions in the chat. We're aware of all the questions concerning the TIAA annuities and the fact that they're designated for health coverage. We know that that is an apparent contradiction. And we'll be, I believe the union is talking to CUNY about that, but please remember that annuitizing something with TIAA constitutes your pension for the purposes of eligibility for health insurance coverage in retirement. So just for those who haven't been at prior meetings where I've made this point, please remember that. In the meantime, the union is aware that people are concerned that they've got a lot of money in some of these annuities and want to know how to deal with it.
Okay, thank you very much, Dean. We're going to go to questions. I have not been able to follow the chat while I'm listening, but we will be going back to the chat and answering those questions or trying as best we can to answer those questions. The only thing I'll say before we go to questions, actually, one thing is please do your best to do your homework. This is why Debbie ran through the website. I know it's onerous. I don't want to do it myself, reading all those documents and explanations, but you each need to do that before you start sending us questions. At least me. When you send to the retiree's email address, the questions come to me and I read them and I do my absolute best to respond. But if it comes down to my having to say to you, go on the website, that means it's there. And because we have 3,000 members in this chapter, 3,000 members, we cannot hold everybody's hand 100% of the time. And I know everybody's doing their best and I'm doing the same thing that you are, but please read the information and click on every single hot link that there is. With that said, it's 1 minute per question. We have 400 plus people on the call. 1 minute per question. I hope that you can ask things that'll apply to more than just you personally. And for the people who are answering those questions, I ask that you be extremely brief or say that you will take that under advisement and find an answer in writing or for next Monday, May 1st. Okay, I see Mimi Abronowitz, then Barry Smith, and then Nanette Funk, sorry. Mimi, unmute. Who is helping Mimi to unmute? Okay, you're okay.
I'm concerned about the kind of outreach that Aetna is doing to providers. It came up in a couple of times. They sent us a packet with a nice information sheet that we should give providers, or they tell us to call the providers, or they tell the providers to call them. I'm wondering, I don't think any of those are going to work very well. And I'm wondering if that information sheet, which might entice some providers to join who haven't, because they'll see the differences, for better or worse. If that's available as a PDF, I would like to send this to my providers and not to have to call them all and then give it to them and then follow up with a call. And what if I want to find a new doctor who I've never visited before? How do I handle that? So a PDF version of that information sheet for providers that we could send by email to any provider who we're trying to interest in working with us, I think would be a big help.
Okay, thank you. So I think that's a recommendation. Do we need a response? Debbie?
I'm not clear what information sheet Mimi's referring to. You're muted, Mimi.
I think it is that when our provider says, we don't know anything about that plan, we need something to show them in writing. Is that it, Mimi?
Okay, I'm saying that in the packet that we just got in the mail, there was about a 3-page flyer telling providers of how easy it is to work with Aetna and how it's to their advantage. But I'm asking if there's a PDF version of that same document that we could then email to a provider and say, hey, listen, this is what I have. Are you interested? And if not, could we ask Aetna to do that?
I believe that Aetna has a very,
It's on the Office of Labor Relations website.
There
If
is
you
a
go to
PDF.
that link, there is the brochure for providers is there. You can print it out. You can scan it and put it in a link to an email.
So I can send it to somebody. Okay, that I have been poking around, but I didn't notice that. Okay. But you might want to recommend to Aetna that they send us, when they email us, just send us a PDF so we don't have to go chasing after it all the time.
okay, thank you, Mimi. Mentioning the OLR is very important, the Office of Labor Relations. This is the plan that they decided that they wanted to give to us. So questions can go to OLR and look on their website. It is not a PSC plan, but we're doing our best to navigate it. Nanette,
What happened to us?
What
What happened to me? I
can
think
you unmute?
Barry Smith. I think they said Barry.
Okay,
Barry.
can
Oh,
you hear
I'm
me?
sorry, I don't see Barry Smith anymore here.
No, we're here.
Here I am.
Okay, I apologize, go ahead.
Okay, so by the way, there is a tear off sheet on their website that they say give this to your doctor. I saw it last night. So this plan that we are being offered through Aetna, I just found out today, it's only a 5-year contract. So all these goodies that they're offering us are apparently only good for 5 years. Now, my question is, our plan that we are on, that we negotiated, our benefit plan, was that for life? That did not have a time limit, did it? I'm asking.
Yes, senior care actually is also a contract between the city of New York and Emblem. And in fact, some things changed over time. They instituted copays a few years ago, which of course were pulled back because of the lawsuit. So this plan is 5 years and 4 months. There's an agreement to renew it for up to 2-year renewals. I think the clear guarantee is for the 5 years and 4 months. What happens after that will be subject to negotiation between the unions and the city and the plan. But, the unions haven't exactly, PSC's fought the good fight, but not everybody has.
It's not a major difference then. So
Right.
the other major difference I'm wondering about is the spousal benefit, because I was told that my husband worked for CUNY. If God forbid he should die before me, I will have to go on COBRA if I'm on Aetna. Is that true with our current benefit plan as well?
Yes.
Thank you.
And also
Okay.
true with the welfare fund.
Okay. Thank
Okay,
you.
Nanette, can you unmute? Help Nanette unmute?
Okay, can you hear me?
Yes.
Okay, thanks. By the way, you've done, all of you, a wonderful job. It's fantastic. So I have a couple of questions. One is, I called Aetna and asked, what happens if I get sick out of country, but I don't have to be hospitalized? Do you cover me? And first they said they didn't know. The person who answered was an idiot. And she had to wait a long time. And then finally she said, no, we don't cover you out of country if you're not hospitalized. So what do we do then? The second is, what about GHI bills that haven't yet been paid by the time that it disappears for us? How do we get those payments? And third, it's almost impossible to do all the research by June 30th on what plan we want as a Medigap policy and make sure that we're actually enrolled by June 30th. And so it's really almost impossible to make the decision to leave GHI and be responsible, that you really have coverage by.
Okay, thank you, Nanette. I'm sorry to cut you off, but.
Yeah,
we have to
okay,
move
that's it.
I'm going to
Yeah,
answer
Eddie,
very quickly.
quickly.
Of course, I probably can't remember all of them. One, international, if you get sick internationally, Aetna offers emergency coverage, but Medicare doesn't cover you outside of the US now anyway. Two is the billing. If you had a health care service prior to September 1st, traditional Medicare plus senior care will pay it. And then, if there's a copay that is due or, a co-insurance that's somehow due in that old plan structure, you will be billed, and it may not be till October or November. But look for the date of service prior to September 1. You need a new Medigap plan to be in place by September 1st, not by June 30th. Your senior care will go through August 31st. So that's the main thing there.
Okay, thank you very much. Hope I'm getting the order right. Teresa Walker, then Lisa, and then Erwin. Teresa, unmute, please.
Okay, I'm unmuted. I have not a question. I have a question, but just as an aside for negotiating with the city of New York, who betrayed us, like Jim Davis said, is there anything on the table about grandfathering current retirees into the plan that we've already had, and that any new retirees would have to go through this process? That's just putting it out there. I don't,
I think the answer is no. Dean, am I correct?
So, yeah, we wouldn't support anything that, sacrifices retirees in training any more than we want to sacrifice the retirees who we have today. What we are doing is continuing, as I said, to look for and advocate ways to restore traditional Medicare plus Medigap as city-sponsored health coverage, so that people would be able to pick that option and still get their Part B reimbursement and their IRMA. And that's the advocacy strategy that we're pursuing.
Okay, somebody's keeping time, right? I think we have a timekeeper. Lisa,
can I have one quick question, or?
I think we really have to move on, Teresa. Put it in the chat, please, because we have loads of hands up and very little time today. Lisa Flansreich.
Can you hear me?
Yes.
Okay, the retirees, you collect approximately $300,000 in retirees dues. When are you going to contribute to the New York City Organization of Public Service Retirees lawsuit? When are you going to donate a dime of our retirees dues?
Well, I don't know.
Yeah,
But we have many people donating individually.
I would like to know when.
Okay, well, I don't have an answer for you on
Right,
that.
you don't have an answer.
No, the chapter.
I want to know. I want an answer.
Well, the answer is I don't know when.
You don't want to donate because you're afraid of the MLC.
Listen,
And
okay,
can I
we're going to go
respond to
on to
Lisa?
Erwin. I know that this is very important. We have many members, individuals, myself included, many people on the call who are donating. As a union and as a chapter, we have not done that.
James is asking to be heard, Pam.
What?
James is asking to be heard.
James, please.
Yeah. So, and Blanca, I know you have a similar question. I think others do here. I think this is an ongoing question for our union, but I would just say at this point, we don't know, and maybe if you can explain it to us, we don't know what the legal theory or strategy is that the retirees are pursuing. We don't understand what it was the last time when they prevailed, right? But in addition to the political question, there's just the question of what's the legal strategy that that the group is pursuing. So when that becomes clear to us, then I think we'll have a clearer idea of whether we need to contribute or decline to contribute.
Thank you, James. That's a much better answer than I gave. And as Dean said earlier, we are in touch with the lawyers who are hoping to bring a suit. Erwin. Ask to unmute, Erwin. Erwin.
Muted now. One piece of information that did come out in the Aetna presentation, which I had not seen before, had to do with the Medigap issue for people who do not live in the 4 states that do not allow medical underwriting, New York being one of them. So people who live in New York have a reason why they might want to waive, because they can get the Medigap insurance without medical underwriting. I live in New Jersey, and of course, about 30% of retirees live in states outside New York. So we would have to face medical underwriting. The new bit of information was that if you waive the city coverage and get a letter from the city to that effect, Aetna will provide you with a Medigap policy without medical underwriting. And that was a new piece of information. I wonder, Debbie, if you know anything about this and whether it would be important for people who are outside of New York State.
I don't know details on this. I'll look to Barbara. I will say it varies from state to state, but and I don't know New Jersey. I don't know if Barbara Caress has more detailed information.
Well, let's get back on that, because Erwin is not the only one who has the issue of being out of state. Thank you, Erwin. Okay, next I see, David Miller.
Yes, I have 2 answers, not exactly questions. I made some calls this week. My wife and I both have doctors at HHS. I called Aetna. Did the hospital take it? Yes. Did the doctors take it that I named? Yes. I went to HHS website. It says they take 11 Aetna plans. Specifically, we do not accept Aetna Medicare Advantage. Are they lying? I called HHS. She said, we are making an exception for this City of New York plan. By the way, it's called CUNY, C-O-N-Y. We're going to take the CUNY plan. It's not on our website yet. The rest of the Medicare Advantage plans from Aetna, we're not going to take. What about the doctors? We are circulating the CUNY plan to all of our doctors. When will you know? Will you know by June 30th? Yes, we will. Call me back in about a month and I'll tell you which doctors are opting into the CUNY plan. The second thing I wanted to know is what's Medigap? How do I find out? I called Emblem Health. I said, I've been a customer for 50 years. The last 15 on GHI Senior Care. I want to keep senior care. What will that cost me? So I'll send you a brochure, but it's going to cost you $225 a month each to have senior care that you have now. The 20% coverage and a couple of other things. So just that's my first, movement into Medigap plans. So if you lose the $4,000 and you have to pay $4,000 or $5,000 for the Medigap plan, you're $9,000 in the hole already. So I'm hoping that somehow, if we opt out, you'll be able to hold on to the benefits from the
Time is
union
up, please.
drugs.
Yep, thank you very much. And I agree with you. I think we all agree with you. We hope that we can work on this and come out with a better scenario. Thank you. Meg Feely? I think, is Meg next?
Yep. Hi.
Hi, Meg.
I have a question. I am currently a pre-Medicare eligible retiree and I'm on GHI CBP. My birthday is September 3rd of this year. I'm really worried about getting caught in the crosshairs. I understand that you should apply for Medicare just generally 3 months before your 65th birthday. So should I go ahead and do that? And second question, I don't know if there's anybody from the welfare fund on this call, but do I need to interact with the welfare fund at all in regard to this situation?
A short answer, Meg, is yes, apply for Medicare, Part A and Part B, and do it, 60 to 90 days in advance of your birthday. Contact the welfare fund. There is paperwork, I believe, which you may have already filled out when you retired, but I'm just not sure if they need updated paperwork. And contact your the college HR office from which you retired to figure out if they need any additional paperwork.
Okay.
It is, I believe, and this is a point I'm not convinced it's confirmed. I believe what the city will do is when they're notified by CUNY, your employer, that you have turned 65, they will automatically enroll you in the Aetna MA plan. I believe that's the way it's going to work, but I haven't gotten that confirmed yet, so I haven't put it on the website.
Okay, but it'll be in your notes, Debbie, I'm sure. Okay.
Eventually.
We have 14 hands raised, please. That nobody else raise your hand. I'm sorry, we have to move. William LaCisa. Unmute.
Hi, thank you for taking my call. I have a number of questions. I'm going to try to do it as quickly as possible. So the first of all, this continuity of care with the death benefits, the spousal having to get COBRA and stuff, would you, is that posted on the CUNY website so I can show it to my wealth management people and discuss how we're going to handle this in the future? Number two, I called Aetna and asked them the advantages of the HIP VIP, and they were very strange about it. After a long conversation, they said there was really no advantage in going to the HIP VIP. I wonder if the union has a comment on that. The third question is, I called my doctor and I said to my doctor, listen, will you accept this plan? And they said, no. And then I called back again to Aetna and they said, oh, the doctor's out of network. And then I got a call back from Aetna, and then the Aetna said that actually they're accepting patients that are existing patients. But then I called the billing office, and the billing office said you'll have to file and be treated as out of network. So does that mean I have to see my doctor, I'm going to have to pay lots of money every time I see the doctor? And does that mean that, it could be refused?
Time, please.
Okay.
Where is this information posted? You just go to the websites that we've given you. I think that's the best I can offer in terms of collecting the miscellaneous information about what happens to your spouse, etc. Two, HIP VIP is a Medicare Advantage HMO plan for a limited geographic area. It is, I personally would observe that for people who've been in HIP their entire working life, it's not a big transition to go into that plan. There are probably many fewer providers available in that network than in the Aetna network, as well as the geographic limitations. As to doctors being out of all these sort of out of network, existing patients, this and that, you're just going to have to navigate your way through it. I mean, they claim they will pay the Medicare rate, which may be less than your doctor is charging. I don't know. He shouldn't be charging, or she shouldn't be charging more than the Medicare rate if they accept Medicare, but you just have to kind of work your way through it. I'm afraid. I don't think there are hard and fast rules that I can cite yet.
Okay, thank you, Debbie. Next I see is Jean Iannuzzi, then Elizabeth Starchevic, and then Stanley Habib.
Hello, everybody. during the Aetna presentation, I asked a number of times that what the proper name of the plan is, because on their website, they have it as Aetna Medicare Advantage, PPO, ESA, CONY. And they ask you to search under that for doctors. I asked several times, and then they finally came up with an answer, because they had been saying that, oh, that's not the name of the plan, it's just Aetna PPO. And I asked them again, so you're telling me that it has the same name, but it's not the same plan. How can you assure us that doctors will take it? And I got some sort of confabulation about that. I'm wondering what our subject matter experts think is going on there.
Well, yeah, I mean, you know, this is like crazy and totally anxiety producing and bad, really bad. And
that we all agree on.
We all agree, and it shouldn't be. And it's terrible to do this to seniors. It's terrible to do this to New York City workers. We're dancing as fast as we can, as they say. This is not our plan. And I am as frustrated as you are, as everybody else is. So we'll do our best.
It would just, yeah, it would just seem to me that they're intentionally trying to conflate existing Aetna PPO plans with this new plan by assuring us that, oh, if they take one, they'll automatically take the other, when in fact, that seems to be contrary to the opinions of some of the physicians that people are getting in touch with.
Thank goodness, you know, we all have certain amount of critical thinking skills and we can figure that out. I mean, this is a company that wants to make money. It's not our friend. And
correct.
And it's maddening. Elizabeth Starcevich. Unmute, Elizabeth. Elizabeth, you there? All right, let's go to Stanley Habib and we'll come back.
Hello?
Okay.
Sorry.
Oh, hi, Elizabeth.
Well,
All
it
right,
said the host
Stanley,
had to
4
do it.
minutes.
Hello, thank you. And I want to thank everybody who's been working on this. Of course, it is still in a very unclear fashion. Can you just tell me, obviously not with a detail, number one, what's the likely cost of regular Medicare, so-called regular? Number one. Number two, does SilverScript, our SilverScript plan have a maximum? And number three, I too have been in touch with both MSK and HSS, and the Advantage Care people whom I sat through today said, yes, they will accept everything, but in fact, it is very, very unclear as to whether they will or they won't. So we need some clarification because too many people are ill. Thank you all.
Thank you, Elizabeth. All right, Stanley Habib.
Answers.
Oh, you
Hi.
need answers.
So
Okay.
Elizabeth, I'll refer you to the article that Bonnie posted, or the Bill posted that Bonnie wrote about possible costs of waiving city coverage and staying with traditional Medicare. That's, you know, the best we can do at the moment. As to the HSS and MSK response, I think David Miller offered us some interesting insights, which is they don't know yet, because when these new plans go into place, but neither the hospitals nor the physicians really focus on them until they're actually in place, which won't be until September 1st. So that is part of the problem that we're dealing with at the moment. The hospitals will accept it for hospital services. We just don't know about the doctors. So.
Thank you, Debbie. Okay, Stanley, and then Elise Newman, and then Marvin Saporin. Stanley.
Stanley here. Can you hear me?
Yes.
Good. I'm a little confused about the relationship of the Office of Labor Relations, the New York City Employee Benefits Plan, and the University Human Resources. Now, relevant to today's discussion, my question would be, if we have difficulty with the Aetna member services, is there an internal, either City of New York or CUNY person that we will have available to answer any questions if we can't get from Aetna? In fact, does one need, sort of related, does one need to file a change of address with all three organizations that I have listed? And for example, the Medicare reimbursement form, the checks seem to be handled at this time by the University Human Resources. Sorry if that's too many questions. Just let's talk about the Aetna portion if you don't want to deal with the other. Thank you. And thanks for everything.
Here's a structural explanation as best I can. The employee benefits program runs health insurance coverage for active and retired employees. It is a subset of the New York City Office of Labor Relations, so that the correspondence that we receive from the Office of Labor Relations, the employee benefits plan is a subset. CUNY HR provides information to the employee benefits program about retired individuals, particularly those whose retirement benefits are with TIAA CREP. Once someone on TRS retires, they sort of become TRS's responsibility. But TIAA information, there's a back and forth between the Employee Benefits Office and CUNY, Central CUNY HR, because TIAA beneficiaries are unusual in the world of New York City retirees. And the Medicare reimbursement checks, most city employees don't get checks. They get money electronically put into the same accounts that their pensions go into. Because TIAA is different, TIAA pension recipients get checks. And CUNY HR is the one that verifies eligibility.
Okay, Elise, please. Elise Newman and then Marvin. And Blanca, I do see your hand, but you're not there yet.
Okay, I have two, I'm gonna put my video on. I have two general kinds of questions that it's just confusion. Because retirees are no longer represented by a union, I don't understand why their health benefits are being negotiated as if we were being represented by a union. So if there could be clarification about that, I'd appreciate it. And then the second thing is that the New York City Retirees Group actually won in court to eliminate the copays when we were under Emblem Health. Why is Aetna now allowed to charge copays for their plan?
Elise, thank God we are part of a union. Our retiree chapter is part of a union that's been standing tall on this. I don't think we have time to talk about other unions today, or, you know, what Aetna's
Let me
motives.
just, Anne, if I could just quickly try to answer
Yeah, why not? Go ahead.
the
Go
legal
ahead.
question.
Thanks, Dean.
So that was one of the theories of the original retiree lawsuit. The judge sort of dealt with it very quickly and not in depth, you know, by concluding in a kind of summary way that he thought the MLC did have the authority to negotiate for retirees. I know the retiree lawyers don't agree with that aspect of the decision. I think that's one of the things they're looking at, trying to figure out if there's a way they could raise that question again in a different way in the new lawsuit. But the quick answer is, as of right now, Judge Frank's decision did say that the MLC could negotiate retiree health benefits.
Okay, thank you, Dean. As you can see, I'm lost without our experts. Marvin, then Janet, and I'm gonna have to make a decision about calling time after Janet. Marvin?
Hi, am I now unmuted?
Yes.
Thank you very much, Ann, and everybody else for your work. My question is are there plans in place to centralize information about problems that people will have when the Aetna plan is implemented, so that to reinforce arguments rather than individuals just having to fight with them, but for a case or for whatever redress is available in the contract to be more easily carried out? Will anybody be centralizing information about complaints about the implementation of the Aetna plan and services people are getting? And thank you again.
Okay.
I think this is a discussion that has not yet happened, but I think it will happen among or between the welfare fund and the union, how to be responsive to people who are having problems, and also, as you say, then create a dossier of problems that could be used in other circumstances, which both there's the politics of it, that's the union side, and there's also trying to help people, which is the welfare fund side. So yes, good point.
And it strengthens the politics of the union if they can say, and yes, we have 700 million cases against the slaveholders. Thank you.
Thank you. Janet Speckman and then Antonella. Janet,
Just have a quick question. Yeah, if I opt out and get a Medigap, will I still get the Medicare reimbursement for what I paid for January through August?
You mean?
Yes. Yes. Her question is, if come September 1st, she has waived her city coverage.
Right.
People will receive Medicare Part B reimbursement for the period January 23 through August of 23, which of course won't get paid until April of 24.
Right. Okay. Thank you.
Okay, thanks. Antonella? Is Antonella Ansani here?
Yes. Hi.
Hi.
I just want a clarification. When Aetna says that they will pay the Medicare rate to the doctors, that obviously does not include the 20% that the Medigap would pay, right? So the doctors would lose that 20%. Is there any way that we could offer the doctors to pay for the 20% I mean, can they accept, would they accept something like that, or?
No. When Aetna says, remember, we have lots of questions about this business of Aetna paying the doctors, but when Aetna says they will pay the Medicare rate, they will pay 100% of the Medicare rate.
Including the 20%?
Is no longer an issue.
I see. Okay.
Okay, thank you. Thank you, Antonella.
No, that's me, and I got my
Oh, I'm
answer.
sorry,
Thank you.
Ann Bard. I think we were conversating over email. Ann.
Thank you so much. I just have a question echoing what several other people brought up involving to whom do we contact at the PSC now and when the plan goes into effect with our questions that we can put in writing?
Barbara Caress, are you waving your hand? Unmute Barbara Caress, please. Barbara, you have to unmute. Okay.
Thank you. There is one of the issues that we have raised repeatedly is reporting. There is a lot of detailed reporting required in the contract between the city and Aetna, but it is confined to a very small circle of people. So the issues of, problems that our people are facing would be in that reporting. And one of the things that we continue to pressure on is that has to be much more widely distributed than just to a small circle of people. That's number one. And it's an important issue, and I'm glad people have raised it. Number two, by law, Aetna has to pay Medicare physicians who participate in Medicare, even if they're not in network, at the Medicare rate. That's not generosity on the part of Aetna. That's the law.
Thank you, Barbara. Faina, if I'm pronouncing it right, I hope, then Barbara Becker, then Blanca. Faina?
Hello.
Hi.
This is Faina's husband. And
Okay.
I have a quick question about copays. When the copays were in effect, we had to pay a facility fee as well as the doctor's copay. Will that be the case under Aetna?
Going once, going twice.
I don't know. I don't think so. I'm not familiar with the facility fee, to tell you the truth, under senior care. But I don't know. The answer is I don't know.
Okay, I hope that can be researched.
Barbara Becker, thank you. Can't hear you, Barbara.
Okay, now better?
Yes.
Okay. In the previous session with Aetna, somebody called in and said that he was getting injections for, I believe, macular degeneration. And there were two forms of medication. One was a cheapie and one was $4,000 to $6,000. And he said, which one would Aetna allow? And the answer to that was hazy for me. And I'm just wondering if this is how Aetna, as a private insurance company, makes money, by providing less effective medications or treatment or whatever for people. And it also affects specialty doctors who may charge more money or more money for medications, particularly cancer medications, which are extremely expensive. And to get the good ones, you have to pay a lot of money. And so far, our current senior care has been most effective with that. And as kind of as an end caboose question for that is, I understand that Aetna is under investigation for fraud. Does anybody know what the fraud is? I mean, shouldn't we know what we're getting into?
Time, please.
Yeah. Well, fraud is bad. No way around that. I think we have to move on, people. I'm gonna let us go 10 more minutes max.
The quick answer to Barbara's question is yes, that's the way they make money. They try to get people to go with the less expensive drugs. They make it hard to get the more expensive drugs. Early conversation with your provider in terms of determining, arguing for the medical necessity of the drugs you're on is going to be very important, but it's a little bit of a crapshoot, I'm afraid. I mean, unless Barbara Caress has a different perspective on it, we just don't know how it's going to fall out. But that should go into the complaint registry if for some reason you experience a hard time in continuing to receive the drugs. The Part B, particularly drugs you've been receiving up to now under senior care.
Okay, Blanca Vasquez and Mark Patkowski.
All right, so we've been talking a lot about actually healthcare, but this is, I mean, particulars, but this is a political fight. It was from the very beginning. There's no doubt that this is a downgrade. There's no doubt that they made concessions just to get this contract, and that 5 years down the line, they're going to screw us further. All right, I mean, there's no doubt about this. So my question is, it's a political fight. That's what it is. It's not a healthcare fight. It's a political fight. I don't know. I still think that, the lawsuit, what it did was actually delay this for at least a year, and so it's a question of whether that buys us time, and time is what we need. I don't think you give to the lawsuit because you're sure it's going to win. The legal strategy is always just part of a strategy. It's not the ultimate strategy. The ultimate strategy is you got to make, the city council people, you got to make, Adams will never get a vote from anybody at PSC, I hope. So and we're not just fighting for ourselves. We're fighting for everybody that's going to retire in the next, year and the next 30 years, right? Because this is a downgrade into the future.
But current people are not up on that, you know, because when I was 30, I didn't think about retirement. You know, so.
Time, Blanca.
Okay.
One question,
Well
so
said.
political strategy, is it the EC? I mean, where's this decision gonna get being made?
Time, Blanca.
Okay, in terms of the political fight, we're actually supposed to be going into a meeting right now to talk about that. And I think hopefully next week we can talk a little bit more about that at the May meeting. I'm gonna call on Mark and Gary, and the rest of you should start putting your questions in the chat, if you will, or send them to the retiree email address. I will read them and forward them on, but we're going to have to stop in a few minutes. Mark. Unmute, please. Gary Rossoff. Susan Newman.
Hello, can you hear me? This is Gary Rossoff.
Who is this?
Hello,
All
Gary.
right. All right,
this is
Susan,
Gary.
hold a second. Gary?
Yeah, I have a very simple, basic question. Why is the GHI senior care superior to the Medicare Advantage at PPO plan? Is there anything specific that you can identify that makes the existing plan better than what we're going to be enrolled in?
Quick subjective answer. It allows you to stay in traditional Medicare. As a supplemental plan, it's not nothing, it's no great shakes compared to other Medigap plans. And the second part of the question is, it's what we're all used to. So, you know, it has worked for people for a long time. So other than that, the plan itself is not such a stellar supplemental plan.
Thank
No,
you.
not
No.
not the Medigap plan, but the Aetna Advantage plan.
Who is
Everybody,
talking? Who is talking?
Gary
Yeah,
Ross.
Gary Rossoff. It's not the Medicare, not the Medigap plan, but the Aetna Advantage PPO, the plan.
Is it worse?
Is it worse? What specifically makes it worse than GHI senior care?
Let me try to say what Debbie said in different words. So senior care is a Medigap plan. So the folks who are in senior care have Medicare, traditional Medicare plus senior care. And I think what Debbie's saying is the thing that's better about that is for many people that you get to be in traditional Medicare, which doesn't have pre-authorizations and has, you know, doesn't have provider networks. So it's not so much the terms, like, you know, the details of the Aetna plan, as it's you give up your traditional Medicare to be in it. And that's the primary difference from our perspective.
Okay, 4 more people ending with Sandra Shapiro.
No.
Okay, next Susan Newman and then Valerie Krishna. Susan.
Okay, can you hear me?
Yes.
Okay, yesterday I was quite happy. I'd spoken to the people at Aetna, and they'd been able to assure me that my Massachusetts hospital was signing on. And then I looked at all of my doctors from Columbia Doctors were on. Then I went to see my primary care doctor at Columbia yesterday. And this person was absolutely horrified to learn that they were on the Aetna plan. And my concern now is that what seemed to be good may not stay good. And the 5-year, 4-month plan does not necessarily say that all the doctors that now are agreeing are going to stay in the game. And that's my dilemma.
Alan, get a phone.
So the question, I just raised the question about
You're right.
5-year.
Ann's distracted. You're right. You know, there is no guarantee that doctors will stay in the plan that are in it now. And not everybody who is listed as being in it, it's conceivable that they don't know they're listed. Also, there is the problem that some doctors think of the individual Medicare Advantage market, which plans they are less enamored of. So yes, but the same thing was always true with GHI, to tell you the truth. I mean, with senior care, people could drop out also. So this is why on a political level, we need to have fights with the hospital systems that are charging too much, et cetera, and so on.
Thank you. Great.
And you're on mute.
Yeah, okay. Please save the chat. I was told that everybody should be able to save the chat. But if you can't save the chat, do not despair. Some of us will save the chat and we will go through it. And there's a lot of important questions and comments in that chat. I can't really follow them right now, but we will pay attention. Barbara Quart and then Sandra. No, sorry, Valerie Krishna.
So before Valerie jumps in, let me just quickly, for people who are on like a desktop or a laptop computer, if you look at the bottom of your screen where it says more, and you click on more, and then it says chat at the top, and if you click on chat, a white dialog box opens. It says meeting chat, and at the bottom of that, near the center, there's 3 little dots that are horizontal. If you click on that, you have an option to save the chat. So that's how you do it.
Okay,
All right,
well, I'm not going there right now because I got to pay attention here. Valerie Krishna. Thank you, Dean.
Yeah.
Valerie, unmute, please.
Wait a minute. Oh,
okay, we hear you. Okay, how about I go to Barbara?
Okay, I'm ready.
Okay.
A few minutes ago, Debbie, some time ago, Debbie mentioned that the senior care will be in effect till August 31st. That was very good news because theoretically then we have all summer to find a Medigap policy. However, we must, by the end of June, waive city coverage officially. There's a little bit of a contradiction here that I'm worried about. When we waive city coverage, there won't be a mistake made by Aetna, I hope, or anyone who's in charge. They won't, by mistake, waive senior care.
Yeah.
When we waive city coverage, do we keep senior care, as Debbie mentioned?
Let me just say, mistakes may happen. The reason the gap between June 30th and September 1st is because Aetna has to submit to federal Medicare all the names of all the people who will be in the plan. So they will drop out of the complete list, the HIP-VIP people and those who waive city coverage. And so there's, now, will somebody somewhere end up in the wrong place? Yes. Hopefully none of you or us, none of us.
How can we avoid that?
Pay attention to your materials. I mean, see what comes in the mail. You can, there should be confirmations from, I assume the city will do, I don't know this. I haven't asked this question. The city should send you a confirmation that your coverage is being waived effective September 1. I will double check that.
Yeah, but the senior care will continue even when the city coverage is waived.
When you've done the exercise of waiving, of submitting a form to waive city coverage, the effective date of that waiver is September 1.
I see. Okay. I got it.
Thank you, Barbara Quart. Unmute, please. Sandra, can you unmute now and we'll come back to Barbara. Can't hear either of you.
It's almost 2:00. It's the whole goddamn day.
Okay. I am unmuted, but
Okay, go ahead, Sandra, quickly.
okay. First of all, thank everybody for your efforts. I absolutely deeply appreciate it, and I'm not the only one. My question is this: unless the lawsuit proceeds effectively, my own choice would be to go back to Medicare, traditional Medicare, and to choose an AARP secondary plan. How and when should I do those things?
You have to, between May 1 and June 30th, you file a waiver of coverage form on the New York City Employee Benefits Program website. That waiver will take effect September 1. You will continue to be in traditional Medicare, so you have to do nothing in that regard. And you search for a Medigap plan with an effective date of September 1.
Barbara Caress, did you want to say something?
Yeah,
Very quickly.
a quick word about the so-called AARP United Healthcare. Those plans are standard Medigap plans. There's nothing special about them except that United pays a licensing fee to AARP. So when you consider the Medigap plan that you want, look at the prices. Don't look at the sponsor. They're
Right.
highly regulated.
Thank you.
Right,
Well,
and
okay,
use that compare Medicare, compare Medigap plan brochure to do it.
Barbara Court is having trouble unmuting. I can't hear you, Barbara. Barbara, can you please write your question in the chat right now, because I can't hear you. I'm going to ask very quickly James if he wants to say anything to wrap up, and remind you all that we have a meeting next week on May 1st, the second part of which we will continue to devote to this. And I know you are all doing your best. I mean, everybody is doing his or her or their best. And we appreciate your appreciation, and we appreciate your support. James.
Just that I see Barbara is really frustrated because she can't vocalize. And so Barbara, I know that you put your question in the chat already, and we'll try to answer that. And everyone who put a comment or question in the chat, we'll try to reflect as accurately and quickly as possible updates to the retiree PSC chapter page that has information about these. And thanks for your forbearance with that. And just to reiterate what's been said already, the union is doing two parallel paths. On the one hand, we are continuing to try to challenge the city's denial, right, of coverage of traditional coverage with a traditional city covered Medigap plan. At the same time, we have to prepare for the implementation that the city has arranged with Aetna. So we're going to continue to try to keep you updated both in writing and also on the website. And this will not be the final meeting like this one that we will offer. So thanks for making the time to come today. And please do feel free to stay in touch. Thank you.
And thank you, James, for standing tall and voting against this, and speaking against this, and taking the strong stand that we wished other entities would take. But we have to do our best with the situation that we're in right now. So thank you so much, everybody. I wish you good luck. Do your homework. Don't come to class without doing your homework. It's in the book. Not everything, of course, is in the book, and we will continue to try to answer your questions. But use the resources that you have and try to stay calm. It's very hard to stay calm, but for me to stay calm. But good to see you all. Have a good weekend, and we will see you soon. We will hear from you soon. We will write to you soon.
Thanks,
Thank you.
everyone. Bye.